Professor Omaswa, for the excellent moderation. I think our time is fast spent. There were very many particular issues to discuss around workforce, both nationally and in the international context. But I think, Professor Omaswa, like you mentioned, you'll be sharing some of these resources and the new developments through ACHEST, which we work very closely with, and colleagues can follow up the discussions from there. That being said, I thank you all, and we can now move to the next panel discussion, which is focused on research. And I will take the pleasure to invite Professor Nelson Sewankambo and our team of panelists to take the spotlight.
Thank you very much, Solomon. So, members present at this August meeting, you are welcome to this afternoon session. I know that for people in Uganda, it is 2 o'clock, but I hope you are not feeling too hungry and you can stand through this session and can put up some very interesting discussions. For the colleagues in UK, of course, they are 2 hours behind, and therefore it is not that late in the afternoon for them. Our session this afternoon, and the chair is Nelson Sewankambo. I'm a professor of medicine at Makerere University College of Health Sciences, but I'm also on the board of the Uganda UK Alliance. Thank you for accepting me as your chair this afternoon. Our session, as you've heard, for the next 45 minutes, is focusing on mobilizing and mobilizing the developing world, addressing the question, how can low and middle income countries take more ownership in setting their research agenda and utilizing evidence? Many times we hear statements from different people in the low and middle income countries that they are not contributing adequately to setting their research agendas in their own countries. And so one poses the question, why is that so? Who has stopped the low and middle income countries to contribute adequately to the research agenda? Of course, there are a number of issues that surround that question. But I think this afternoon we'll be given some insights on how we in the low and middle income countries, and in particular Uganda, can take more ownership in setting our research agenda and also utilizing the evidence that accrues from the research. Because research is done for a purpose. And therefore, at the end of the day, it is not enough to just do the research and then move on to the next piece of research, but rather to reflect, to utilize the research which has been done or the results which have been obtained, of course, putting in context what other findings they are from particularly regions of similar context, and then putting all that together and being able to move forward. With those few remarks, let me invite my colleague, Professor Pontiano Kalebu, who I'm sure many of you know is the Executive Director of Uganda Virus Research Institute. Pontiano.
Thank you very much, Professor Nelson, and thank you, the organizers, for inviting me to be part of this panel discussion. So as I've been introduced, I'm the director of the Uganda Virus Research Institute, but also I'm director of the MRC Uganda Virus Research Institute and London School of Hygiene and Tropical Medicine Uganda Research Unit, which is part of the London School of Hygiene and Tropical Medicine. I'm also a professor at the London School of Hygiene and Tropical Medicine. And like Nelson, I'm a board member of the Uganda UK Health Alliance. So the topic and the panel discussion, we are talking about mobilizing the developing world. How can low and middle income countries take ownership in setting research agenda and utilizing evidence? I think this is a topic that we keep talking about. I've given a number of presentations and discussions on this very important topic. We always find, we discuss the challenges and where we are, but we need to find a way of moving forward so that we can really ensure that we meet the expectations. I followed the discussions earlier on in the day on the universal health coverage, the global COVID pandemic. But as previous speakers have mentioned, I think COVID pandemic has shown us that we are a global village. The disease was identified in one part of the world, corner of the world, but within a very short time, it was affecting the whole globe, all corners of the world. So this made us more realize that really we are one small village and we need to work together. But at the same time, COVID has shown us how responses can be nationalistic. My country first. When the supplies were getting limited, I've been in the middle of it, testing for COVID, and I've seen how challenging it has been to procure diagnostics, to procure personal protective wear, to procure a lot of things. And the countries became very nationalistic, my country first. And that, of course, put a lot of worries on many of us and many countries. And even here, the president said, why can't we make efforts to develop our own innovations in areas of PPE, in areas of diagnostics, vaccine, therapy, and all that. And he has been encouraging, again, to mitigate some of those worries, nationalism that is cropping up that we saw during the COVID. But good that through, again, as a global village, working together with many partners, I think we are now talking, going back and saying, we need to ensure that there is supply and this supply reaches even the low and middle income countries. But that was quite important. So it's a global village, but we need to be aware that we need to strengthen how we can address our health needs through research and also utilize evidence. What are some of the challenges that we are facing in the low and middle income countries? There's poor stewardship. Research governing systems are not that strong. We have limited research priority settings. We have limited regional partnerships and collaborations. We have limited information management systems. We have poor knowledge translation and evaluation. And then this is something we need to discuss, how we utilize our research. In terms of using our evidence for research, in many cases, we depend on outside data to change our practice and policies, sometimes waiting for WHO and others. We have also poor development and harnessing of commercialization, because commercialization attracts and is an incentive for research, but this is quite poor. And there are many issues around that, including intellectual property. We have inadequate resources, infrastructure. Early in the morning, we talked about internet, connectivity, and all that. Some of my colleagues took time to connect. These are all issues that we are facing. Human resource is a big challenge that we have. Financing. It's estimated that it's on about 0.3% of health sector budget that goes into research, 0.3. So we're much, much below the declarations that were made in Abuja, in Bamako, in Mexico. So we have a long way to go. But how can we take, I know, of course, there are steps that have been taken to address some of these challenges, and we are moving, we are making steps. small steps in the right direction. And we need to do more. How can we ensure that this is quite important? I think we need to make people aware the importance of research. Research is important to generate knowledge and promote, and we have to promote it if we are to tackle our priority health research challenges. People also need to be aware that research may not lead to immediate health benefits, but it is incremental accumulation of knowledge and information that we need, that will lead to new discoveries of intervention in diseases in different ways, so that we can improve the health of our population. But research also leads to additional benefits: improve the infrastructure, better trained staff, better information generation, and many others. As I said earlier, we have participated in many of these discussions before, and we agree that there's some gradual improvement in some areas, in some countries, but not in the others. Yeah, and also as a global village. I think from the very start, we need to see, do we have a conducive environment for research in our countries? To give an example of Uganda, I think the environment is there. We need to do better and advocate. We have the National Development Plan, which talks about promotion of science, technology, and innovation, which that box can be ticked. We have the National Health Policies, which again talks about implementation will be evidence-based, which is again an important policy document. We have the Health Sector Development Plan 2015-2020, which talks about health information, research, and evidence generation. Again, very, very important. In 2011, the Uganda National Health Research Organization Act was enacted, which was established as a semi-autonomous regulatory institution for coordination, alignment, and harmonization of research health. And there are other bodies, the Uganda National Council for Science and Technology, and many others that support our research, but also our other neighboring countries like Kenya. They have a functional Kenya Medical Research Institute. Tanzania, they have the National Institute for Medical Research, and others. But we are not at the same level. We have also regional bodies, regional and continental. We have the protocol in East Africa, the East African Health Research Coordination Commission that was set up in 2008. It is set up, but how do we make it functional? I mentioned about the declarations we have made in Abuja. 15% of the national health budget should go on health. That was followed by the Mexico health statement, and then the Bamako call on up to action, research and health, where countries committed themselves to allocate at least 2% of the national health budget to research. But as I mentioned, now it's averaging about 0.3, very, very far off. The African Union Health Strategy 2016-2030 saying that evidence is the basis for sound public health and practice. And then internationally, we have many, again, environment, the SDGs, the declarations that have been made, all of them are important. But where is the problem? The question is, where is the problem? The environment is there. I've said it's not the same in every country. In some countries, it's better than others. But I think in Uganda and East Africa, in terms of research, at least we are ahead of some of the African region. But where is the problem? I think the problem needs to be in how do we implement? It's advocacy. How do we advocate at the political level, the public, the media, international bodies, NGOs? We need to advocate to ensure that what we have stated and what we have talked about really is put into effect. Advocate to implement the declarations, the laws, and the acts that we have made. I would like to give you an example of the institution that I lead, the Uganda Research Institute, which is a government institution, but working with many international partners. About 4 or 5 years ago, our funding, a lot of the funding we have is a mix, government funding, partners, grants, research grants, competitive research grants, cooperative agreements, bilateral agreements. And I sat down to find what budget did we have as UVRI together with our partners. In 2018, 2019, we had about 32 million US dollars. But the government contribution at that time was only 6.4%. But we made a lot of advocacy, talking to Parliament, talking to Minister of Health, talking to Finance, informing them about the work we do. Especially people, you have to sell your messages in a proper way for people to understand the work we do in Ebola and the work we do. The government funding to our institution about 4 years ago, 2-3 years ago, increased by more than 1,000%. They gave us more money, they have given us more funding, and the results can be visible. Results can be visible because recently, for those colleagues in Uganda, we are aware when the COVID pandemic was recognized in Uganda, the UVRI was ready, testing, supporting other labs, providing the information on the COVID situation in Uganda. We did not have to put in much more because we already had built enough capacity. We characterized the virus of COVID, we sequenced it, provided the information. We have worked in different areas to understand the COVID disease. And this is really an evidence of whereby if the government invests in research and institutions, then the benefits can be realized. Then the other important thing is partnership as we build our capacity. As an example, at Uganda Bioresearch Institute, it's one of the challenges. We need to build partnerships, local and international partnerships that will lead to developing research capacity within the country. It's very, very important. That will help us. We need to improve our governance. The relevant bodies should be supported. I talked about the research priority settings. We need to have a consultative process so that we have priority setting, funding, so that we can increase on our funding, which can be local and international. I talked about the Uganda National Health Research Organization, a very nice act, but it's not funded. There's no funding. They must have advocacy so that such bodies are funded. Training, we need to build a critical mass so that we can do good science, run the institutions and attract funding. There should be career path for our researchers and opportunities for growth, which is now very limited. It leads to brain drain as people go abroad or they leave research and do other things. Then strong institutions, including universities that are well managed and funded. And then address other areas of intellectual property and the rest. And finally, I cannot end without talking about bringing in the private sector. It has been a challenge in Uganda to bring in private sector. We have had discussions with them. Unlike other colleagues in South Africa and elsewhere, where private sector has played a very big role in Uganda, as far as research is concerned, they have not come in as much. But private sector was very helpful and powerful during the COVID pandemic, and it continues. Maybe we need to build on that and see how we can also raise funding in our low and middle income countries, private sector, which is building in many of our African countries. So those are my opening remarks that can stimulate some further discussion. But I want also to end with this very, very important one. One other challenge, and this is a challenge to our senior researchers in Africa, who at times are contented with serving and working with international bodies and other universities. They are very well funded. They send samples, specimens abroad, but they don't take enough interest in local capacity building or not enough in local capacity building. They become local PIs to serve other institutions and organizations. I think that also I've seen it in a few other African countries. Senior researchers, scientists have to be advocates to ensure that there's the tilting of the balance, gravitation to the south. Thank you.
Thank you very much, Ponciano, for that detailed elaboration on these issues. The audience, please keep your questions, post them in the chat box, and we can get back to them during the discussion time. Let's move to the Wellcome Trust. And I think this is a video to be played.
No.
Oh, is that? Sorry.
It's Branwen. Pleasure to see you again, Nelson. And Pontiano as well. Pleasure to meet Rosalind and Andrew. In fact, Pontiano, the last outing I had before lockdown was to Uganda.
Yes.
So good. So I'm going to launch straight in. Just for background, so I am in the science division at Wellcome, and I deal with quite a lot of the international activities that we have. I look after the Kenya Kemri Wellcome program. I look after the international fellowships. I'm involved in the Deltas programs, etc. So I come with that lens to this discussion, and I'm happy to be here to contribute. I'm a very strong advocate of capacity building, and in my role at Wellcome, I can do something about this, which is great. I'm also a very strong advocate for research equity, and I think the topic of this discussion around driving the research agenda from within low and middle income countries is hugely important. So Pontiano has touched on quite a number of points, so I'm not going to repeat those, but I just wanted to bring out two that I think are very important. So one is, I think, to really drive the research agenda, it should, from within low and middle income countries, it should be driven by relevant stakeholders and with consideration of the local, regional, national, or potentially international context. And by stakeholders, I mean the actual population in those settings, researchers, governments, and funders as sort of four key groups. There are others, of course. And one group that has had quite a lot of influence, partly because they have the money, is the funders. And that's why I think in many ways the research agenda is driven by the global north, because that's where the money comes from and funders have their interests. But I think that is problematic. So the real crux to me in that respect is that what Pontiano alluded to is that we need both financial commitment, but also engagement from governments in low middle income countries to really make a change there. The other point is capacity building, and I agree again completely with Pontiano that we need local capacity building from the ground up in low middle income countries, and there's some very good examples how that is happening, because then those researchers can infiltrate, so to speak, all of the structures, and we need to have the environment that they understand and can drive and lead on research ecosystems. So those are the kind of two main points that I wanted to make. I just wanted to give a couple of examples to highlight how it is possible to do this. One example I think that you will be very familiar with in Uganda is the Deltas Africa programs. So these are funded through Wellcome and through DFID. So these are programs that stands for Developing Excellence in Leadership and Training in Science. Nelson is leading one of these. And these were originally funded from Wellcome to the individual consortia across Africa. There are 11 of them. But one of the conditions was that these programs need to be led by scientists in Africa. And since these have been launched some 5 years ago, they have been transferred to the management under the African Academy of Sciences. So it is showing what we call shifting the center of gravity and really making a point of giving an emphasis on African-led, African-managed, African-driven science, but also that the schemes themselves, so to speak, are driven from within the continent. And I think that can have a huge effect longer term on driving the research agenda from within. Another example is some of the work that the UK CDR does. So UK CDR is the Collaborative on Development Research. It's an organisation under the umbrella of which the Medical Research Council in the UK, Wellcome Trust, the Department of Health and Social Care, etc., come together to align our direction of travel on lots of different topics, including health research, They are, for example, developing guidance on equitable partnership. There is a lot of work amongst UK funders around research culture, and I think that feeds in heavily as well. But the difficulty I think that we always encounter is how to get the people who really should be at that table and at that discussion to the table. But one encouraging development that I participated with was that we have what we call the International Research for Development Funders Forum. And last year that was combined with the Science Granting Councils Initiative. So that's Science Granting Councils across Africa. And we had a joint meeting. And I think that was fabulous because it meant that we actually could sit at the same table in the same room to discuss topics that are relevant to research. So I'll leave it at this for the moment with these two concrete examples, I think, of positive developments that could be fostered further to really drive the research agenda in low middle income countries.
Thank you very much for those insights. I'm sure they are going to provoke also a lot of comments, questions, and so forth. Let's move on to Dr. Andrew Kambugu, who is the Executive Director at the Infectious Diseases Institute at Makerere. Andrew, you are probably making the same mistake I was making at the beginning. People were only seeing the top of my head and they couldn't see my entire face.
Can I check that you can see and hear me well?
Yes, we can see your face and we can hear you.
Great. As it happens, a call just came through on my office line at the time that I've been introduced, but I'll ignore it. Good afternoon to you all, wherever you are. As you've heard, Andrew Kambugu is my name. I'm the Executive Director at the Infectious Diseases Institute here at Makerere. I'm very delighted to join this discussion, and I look forward to the discussion at the end of the panel submissions. I have been at the Institute for over a decade and a half and had the opportunity to lead the research program. And now I'm the head of the institution. And so I will be looking at this topic through the lens of an African-based institution based within a leading university in Africa. And I'll also be building on the remarks that have been made by my colleague panelists, Ponciano and Branwen. I know they have highlighted the issue of advocacy for governmental resources, as well as I think Branwen laid out the different stakeholders and pointed out the differential influence of funders when it comes to setting research priorities. So within that context, and also appreciating that we are in the COVID-19 context, and Dr. Tegnen of the WHO highlighted the challenges that we foresee in terms of funding. I think it's in that context that I'm going to make 3 points. The first point I'm going to make is that in terms of setting priorities, investing in institutions is really important from my perspective, particularly institutions that support a pipeline of motivated and talented investigators who are team leaders and who nurture the next generation of researchers. I think many times discussions on research priorities might focus on investigators, and I feel that sometimes the role of institutions is not highlighted. I'm glad that Ponciano highlighted the role of institutions because that guarantees some durability in terms of the capacity to really set the research agenda. At the IDI, I wanted to share the reality where the research program has invested in nurturing a set of investigators to a level that they can compete globally for resources. And we've had the experience where fairly junior investigators over a 5 to 10 year horizon have really been nurtured to become group leaders in their respective areas of research. And for me, the point here is that I think in Africa and other settings, there's an underappreciation of the duration it takes to really raise a research leader of the caliber of Professor Sewankambo and Professor Pontiano. And sometimes they are inclinations to get shortcuts. And yet, if we are really to have leaders who can advocate to government, can point out priorities, we really have to make that investment in these research leaders. And I think that the best platform for these institutions. So my first point really, if I can just, just emphasize is that we need to continue to invest in strong institutions that have a system of identifying and chasing after talented individuals and keeping them motivated and happy, and ensuring that they go through the due diligence towards research independence. My second point is around governmental investment, something that Pontiano has highlighted. And I think in the case of Uganda and Makerere, I just wanted to highlight, like Pontiano noted, that we're beginning to see some changes that are positive. So at Makerere, I'll be pleased to share with this audience that the leadership of the university has convinced government to invest into a research resource that can be competed for. In this case, it's called the Makerere Research Investment Fund. The fund currently is about $8 million, of which 50% has been dispersed. And I'll be happy to share a link about this development. So I have many colleagues across the university who have applied for resources competitively in the context of this fund. And in this fund, I really see early beginnings that could get Uganda to have systems like we have in the UK with the MRC and related funders, as well as the US with entities like the NIH and the CDC. So these are early steps, but I think it's movement in the right direction. And it's also creating a review process for research, which I really think is a part of a robust culture for setting research priorities. The final point I want to make relates to utilizing research findings. And for me, the central thing there is academic and research institutions addressing real societal needs. I'm pleased to note that when I led the IDI research program, the goal was really to do studies of a high quality that address policy and practice. And I wanted to highlight an example of a group in that program that has focused on meningitis within the African context. Of course, this focus on meningitis by this group was triggered by the HIV crisis in this region. But this group has consistently, in consultation with communities, conducted a body of work in meningitis. And this work has really found its way in the guidelines, not just in the country, but in the region and globally. And I think this is the case because the research group chose to really pursue a research subject that translates into real gains when innovations and insights come out of that research. And so the point I want to make is that research groups, research institutions, as part of societal accountability, should really position themselves to target health priorities, because when they have research innovations, it is easier to translate those in research and policy. So I thought I would make those 3 quick points. And I wanted to note my colleague Rosalind, even though she was introduced with a Cambridge hat, I've had the opportunity to serve with her at the IDEA here at Makerere. So thank you very much, Chair, and I look forward to a discussion. Thank you.
Thank you very much, Andrew, for those interesting points. Yes, let's move on to Rosalind Parks. I'm not sure whether Rosalind is now talking as somebody from UK or somebody from Uganda, but let's wait and hear. Rosalind.
Thank you so much. So as has been made apparent, I actually have a joint contract. So I have a contract in Uganda, which is where I am, and I have been since the beginning of lockdown, but also I hold a position at the University of Cambridge. And that's something, a model which is very unusual and quite challenging from time to time, but I think that it could be something worth exploring. Prof. Nelson, is it okay if I just share my screen? I thought I knew that my esteemed colleagues, so I'm really grateful to be here, and it's so nice to see so many of my teachers, leaders, people that I haven't seen for a while, mentors. So it's lovely for me to say hello to everyone. I knew that my esteemed colleagues in this group would be talking about the main theme. So I thought that I would touch on something a little bit different, which it has been really occupying my mind a bit during the outbreak, which is how we can use the COVID situation to see if we can make a change in the way that we do research capacity building and the way that we interact with each other. Holding this joint appointment makes me think about it quite a lot. So I just had a few points. One of the things that I don't think we've talked much about today, yet to me it's a bit of an elephant in the room, is the fact that if the Ugandan response in terms of the public health leadership and the Ministry of Health leadership managing to advocate for strong public health measures at the beginning of the epidemic has really affected in a positive way the Ugandan response to the COVID crisis. And, you know, it's led to, in the Lancet Commission, Uganda being in the top 10 countries in terms of COVID response. And I think that actually the example of Uganda, other countries such as Vietnam, are opportunities for us to reframe the North-South knowledge transfer, because I think post-COVID, we really need to take the learnings from lower and middle income countries that have done well, and use that to advocate for general bilateral learning and rebalance the kind of research, the kind of colonial, the old-fashioned colonial approach of North having knowledge and transferring it to the South. I think that leads to something that I think can make a difference from within, which is confidence in research, and really making sure that relationships are equitable comes from you know, the knowledge and the confidence that you're making a difference. So one of the things that I'm lucky enough to have is PhD students both at Makerere and in Cambridge. And what I've been trying to do amongst this group is to really help colleagues and put colleagues in touch with each other to support each other in their respective areas of research. And I know that at the moment, my Cambridge students are actually benefiting much more from the support from the Ugandan side than vice versa. But I do hope that balances itself out. But I also think that gives confidence to the Ugandan PhD students that really they are on a level playing field. In a lot of areas, they have more on the ground knowledge and more expertise than some of their colleagues in the UK. And that often comes from people doing their PhD a little bit later in life in Uganda than in the UK. So having that world experience, having that real life experience that Andrew and Bronwyn has talked about in terms of addressing research priorities. And the other, ideas, as I put on my Cambridge hat, activities such as the Thrive program through Cambridge and the London School, which mentors PhD students and gives them opportunities to visit universities in other places, and the kind of Cambridge Africa program, really trying to make sure that there is equitable partnerships. Just something on equitable partnerships. I mean, Prof. Ponciano mentioned it and Andrew mentioned it as well. I think that partnerships are extremely important in research. And for example, many colleagues of mine in Cambridge have partnerships with the US, partnerships with other UK universities, and they are very, very equitable and seen to be even. So I do think there are very much models of partnerships where there are equitable, and I think we need to start seeing our relationships with UK universities on the same footing as if, we were an American university coming into this relationship. So the next area is digitalization and online learning. And I know that we have talked about the challenges with internet, and as David Lelu mentioned, my research interest is in delivering support and training through telephone calls, so mHealth. But I do think that within those people who are accessing education, there is quite a lot of access to online learning. And really, I think this provides us with a big opportunity for equity in postgraduate training. So Cambridge at the moment are revising their masters in public health, and those of us who are in the global health core are really taking this as an opportunity to say, how do we get more international students on this course? How do we make the course more equitable because it's being delivered by Zoom and we can reduce on travel costs? And how do we make sure that we get mentors and teachers from all over the world, not just people who were in a train ride away from Cambridge? So I think that there is this big opportunity for us at the moment to really think about how graduate training can take advantage of the fact that we're not traveling so much anymore, and that people have got so much more used to doing online activities such as today. And I think with the rise in data science and dry labs for research and public health and health research, this also gives us a big opportunity to have much more equitable and shared research projects where we don't necessarily have to be physically near each other. The third area is what was mentioned earlier on in terms of global solidarity. And it also touches on what Andrew and Ponciano said about research funding. I mean, this is a bit of a personal appeal from me to the Uganda UK Health Alliance to request some advocacy for joint funding. So for example, Newton funding, which Uganda is not signed up to, is joint funding between two different countries, UK and one other country, for institutional partnerships, PhD. I'm a reviewer for this, and there's some really great projects that come through. And yeah, I always find it a shame that Uganda is not there. So please, those of you on the UK Uganda Alliance board and teams, please could we try and explore Uganda signing up to Newton funding, because I think that would be a great source of funding. And I'm sure there are other joint activities as the government of Uganda is starting to invest more in research. And then the last thing is about publication bias. So I think that there is a publication bias away from Africa because most of the journals belong to the global north. Now, potentially this is an opportunity for us to engage with the private sector in terms of coming up with publications. But I think it's important because I think it would allow us to do two things. I think we have an opportunity to leapfrog, like we have done with mobile money and other things. We have an opportunity to leapfrog over bad practices that we see outside, or come up with more innovative strategies. And I think that we have got many cadres of staff, including nurses, community healthcare workers, people who run community pharmacies, who really would like to engage in research. And I think that if we had more access to publications, we would be able to really get more cadres of staff to engage with research. And that could be a really positive drive from our part of the world. And that's because our health workforce is quite small. Therefore, we need everybody to get engaged with research. And one of the best, one of the most productive PhD students I have is a nurse who's churning out papers like there's no tomorrow. So I really think that this is an area that we could encourage. The other thing is on research confidence is having to review other people's papers. Getting the experience of being a reviewer really helps your own writing skills. One of the things that I get asked all the time is, can I have teaching on how to write an abstract? Can I have teaching on how to write a paper? Can I have teaching on how to write grants? And really, I keep saying, well, yes, we can give you some teaching, but really it's about just getting practice. And I think being involved in reviewing research articles of other people's is a really good way of honing your own writing skills. And I think if we had more publications that were easy for us to access in Africa, would help with that at all as well. So that's my slightly different take. Thank you very much for listening.
Thank you very much, Rosalind, and all the other panelists. Now, I haven't been very good at managing time. So we have just like 5 minutes to the end of the session. What I propose, and there are not many questions that have been posted in the chat box. However, one of the three that I've seen is talking about using research evidence. And indeed, the speakers haven't addressed themselves very much on this issue of how can countries, a country like Uganda, promote the use of research evidence? If any of the panelists would like to speak to that, a few points on that. Yes, please, Brown.
Just one thing to, so, from the lens of a funder who sees research proposals, one of the things we often see is that people submit grant proposals where they say this will be translated into policy and practice at some point. And as Pontiano pointed out as well, research takes a long time. But I think one of the issues often is that researchers do not involve policymakers from the outset. And I think in order for there to be a real chance and real opportunity to be for findings to be translated into policy and practice, there is a need for involving policymakers from the outset of research so that they can co-produce potentially even the research. The other thing is what Rosalind mentioned is publications. So negative bias or bias towards not publishing negative results is also an issue, I think, and that is important because there's a lot of repeat research because negative results aren't being published. But one of the very positive and encouraging developments is that there are now open access platforms, for example, through the African Academy of Sciences to publish within the continent. And I think people should be able to use that to get their findings out there and for them to be hopefully co-produced with policymakers and therefore translated into policy and practice.
Thank you. Any other panelists who would like to say something about that?
This is Andrew. I just had a short submission which complements Bronwyn's submission, which focused on the policymakers themselves. It's my strong view that also the community is a great stakeholder in terms of translating research. So if communities, and here I just don't mean the participants, but where you have engaged community advisory boards and such bodies that really articulate some of their priorities and have discussions in such groups, then I think we can mobilize the muscle of the community to put pressure on governments to use evidence that has been generated from studies. And here I should mention we've actually, the IDI has obtained some funding around engagement of the public in science. And we've seen some very rich interactions with journalists and communities coming out of such efforts. Thank you.
Thank you very much.
Just
Yes.
a very brief one. Also, our policymakers sometimes they are waiting for, and I mentioned this, sometimes they're waiting for other research. What does WHO say? What does this one say? What does they have to gain some confidence. If a study is well designed, it has enough sample size, it has been done very well to take some bold steps. Many times there's that the results we have produced in the country that have not been taken on because the policymakers are waiting. What do the others say? So it's really a step, there's that caution. So we need to interact with them. If a study is well designed, very clear results, the policymakers to make bold decisions, not to delay and wait too much. Thank you.
Well, at this point, let me say, Ponsiano Kalebu, as a member of the board of the Uganda UK Alliance, he's actually the board member from Uganda who is leading the research committee. And the issues we are talking about here are squarely in the ballpark of the research committee. How do we make sure that Uganda and Ugandan researchers with the public and government can play a greater role in setting research agenda? And also, how can we as a country promote the use of research results in informing policy, in informing practice, and so forth? In the remaining 1 minute or so, let me use it also to make a point which has been put out, spoken to by Dr. Branwyn from Wellcome Trust. For those who are not very familiar with the African Academy of Sciences, one of the things it prides itself in the last 5 or 6 years is what it calls shifting the center of gravity. And Dr. Branwell made a point, shifting the center of gravity. So shifting that center of gravity as far as research and research capacity goes from the north to the south, Africa itself. And always, because I interact with the African Academy of Sciences quite a lot, I keep thinking about how can we shift the center of gravity from the north to Uganda, the very subject that we are talking about now. It's a very interesting approach to the way research and research capacity building is approached. So I would encourage all of us to think more about this. The second point before I hand over the chair is what was mentioned by Andrew Kambugu. During the COVID epidemic, government has put aside $8 million to support research in Makerere. And this has never happened like that before. How can we build on that momentum so that government continues to put money into the Ugandan institutions? And it is when the country is investing money itself, is putting in sizable amount of funding to research, that really will facilitate our setting the research agenda. The agenda around COVID, as done by Makerere, is set by no others but the people in the country, and Makerere at that. And the review mechanism that was developed is also dictated by our own institution. What am I saying? That we need to develop a very strong mechanism to continue advocating with government that they should put money, they should invest in the local institutions. And again, as part of the Uganda UK, that can be one of our very important agenda we have to address. On this note, I would love to hand over the chair. Thank you very much, panelists. I'm sorry that we haven't had plenty of time to discuss, but I think we've, people's appetite has been stimulated so that they continue thinking about these two issues.